What level of LDN do you find to treat MCAS? It says, I am on 4.5, I'm assuming milligrams, and have not found it to be much help. I have a host of issues. Current issues are chronic hives. I have been treated with antihistamines, Xolair, Dupixent, and continue to have horrible hives. Well, part of the problem, I think, I'm not big into these monoclonal antibodies and Xolair and Dupixent. I don't use those in my practice. What I do use are some what I consider safe and a short list of antihistamines, H1 blockers, anything as simple as over-the-counter Benadryl, Zyrtec, Claritin, those kind of things. Atarax, hydroxyzine is another in the H1 class of blockers. H2 class would be things like Pepcid or famotidine. While it's used over the counter for reflux or dyspepsia, it is a type of histamine blocker. And then there's leukotriene inhibitors like montelukast or MLK, otherwise known as Singulair. I like to use that more in the adult population, even though it's formulated for children, but there is a black box warning for suicide in children. So if they are on it for a very short period of time, I'm watching them very carefully. Alternative in the herbal realm is Butterbur extract. So Butterbur root, you have to get the PA-free Butterbur, traditionally used for migraine headaches, but also is a MLK substitute. There are a whole host of other things that can be used. Prednisone, steroids is one. Coltracine is an old gout medication. Of course, we have LDN, and the dosage on that can vary wildly. I mean, I start out slow and I titrate up for effect, and sometimes I BID dose it, twice a day dose it. Methylene blue, there's types of energy healing or energy medicine. Peptides, there are a whole host of healing peptides you can use, sub-Q or oral. Cannabinoids, those are the components of cannabis or hemp that are useful. There are hundreds of cannabinoids, and they can be used in combination with terpenes to help with this. In addition, I use them a lot with LDN in pairing them up. And also a repurposed drug called amloxanox, which has been FDA approved for aphthous ulcers, but is used in Japan regularly for treating asthma, anaphylaxis, allergies. So amloxanox is also used and paired up with LDN and cannabinoids. The upcoming LDN conference in Portland, I will be co-presenting a lecture with a PharmD from Texas on that very subject. I use peptides, amloxanox, and other antihistamines. That's in the pharmaceutical realm. If we want to look at natural alternatives, quercetin, curcumin, like from the turmeric, bromelain. We mentioned butterbur extracts. Also, probiotics. It's important to keep your GI tract well and healthy. Vitamin C, stinging nettle. These are historically used as antihistamines. Also, omega-3s, as in fish oil, and something called SPM. Those are specialized pro-resolving mediators. They're components of the omega-3 that actually work better. I have additionally added things like coltracine, the old gout medicine, that is a very potent anti-inflammatory. Other things you can use topically are DMSO. It's very regional, so if you have certain joints or certain body parts that actually are symptomatic, you can apply a thin coating of pharmaceutical grade DMSO, and that might be helpful to some folks. As far as the LDN dose, I usually start low with my patients, zero point 0.5 to 1 milligram, and then titrate up for effect. Now, I have some people on a total daily dose of 6 milligrams, but 3 milligrams 12 hours apart. Now, if something's just not going to work, I mean, LDN is not 100%. I mean, there are people that fail it. I will move on to other agents like transfer factor, colostrum, and some more aggressive botanicals. But we also have to find the triggers, and you have to find underlying root causes for things. Because if you don't address those, you're probably not going to get better.